Well, there's probably a range of severity in fetal urinary obstruction, but the things we look for first and foremost are the quantity of amniotic fluid. So if the quantity of amniotic fluid volume is very, very low, or oligohydramnios, that indicates a very serious form of urinary obstruction. If the amniotic fluid volume is normal and the main findings are in the urinary tract, that is a dilated urinary bladder and potentially a dilated posterior urethra, then the most likely diagnosis would be posterior urethral valves if it's a male fetus. Once we make that observation, we look for a number of other things. One is the appearance of the kidneys. They're often a little bit dilated. They have hydronephrosis. But if the morphology of the kidneys is maintained, there's good cortex, and this area of the middle part of the kidney, the medullary areas, are still intact, it's very likely that the fetus hasn't suffered terrible, irreversible kidney damage. However, if the fetus has echogenic kidneys with hydronephrosis, and most importantly, tiny little cortical cysts that may be very difficult to observe at first glance, but we look for them. They have those tiny little cysts. That's virtually 100% predictive of this thing we called cystic dysplasia, which is an irreversible kidney damage as a result of more distal urinary tract obstruction.